I've always been fascinated with medicine. I've worked for an OBGYN, I worked at Barnes Hospital in St. Louis, Missouri, and then I got the chance to talk to Dr. Tony, and boy, is this guy smart. Welcome to the show. How are you?
Hi, Donna. How are you?
Good. We had a fascinating conversation the other day on the phone all about veins.
Yes.
And fixing veins. So tell us about why you decided to become the doctor that you are today. What was your it in life, your why?
Well, I mean, from a young age, even in high school, I decided that I wanted to go into medicine. I looked at all the different possibilities as far as a profession, and I never saw myself as anything else than a doctor.
Okay.
And then as I went through my training, I decided that vein disease or vascular disease in general was something that I really wanted to do because it really makes a difference in patients' life.
Because your vein system is really what takes blood throughout your whole entire being.
Yes.
So it's the basis of what has to be correct.
Yes. You have your heart, right?
Yes.
And the heart pumps the blood throughout your body through arteries. And usually most of the problems that we see is in the arteries. Now the veins return the blood back to the heart. If you don't return it back to the heart, then it stops.
What's the most difficult case you've ever had to try to manage or help?
Well, in the venous side, we take care of patients with arterial problems and vein problems.
Okay.
So on the vein side, the most difficult cases are patients who are in the more advanced stages of vein disease. So that occurs when you develop ulcers in your legs, sort of skin breakdown, and you have an open wound.
So how do you know, like what are some of the early symptoms or signs that somebody might, be present to that they should go get help? Like how does someone know?
Yeah, I mean, vein disease is very common.
Okay.
I mean, 1 out of 2 people will develop vein disease in their life. And it could be anything from little spider veins all the way, like I mentioned earlier, you can get an ulcer. Some of the signs and the symptoms is obviously you can see varicose veins, so that's pretty easy even for the layperson to recognize that they may have a vein problem. But it's not just the visible part, it's what kind of symptoms they have. And the symptoms is, they get heaviness, tired, achiness in their legs, they may have itchiness, they may develop a clot in the vein, and they have a lot of pain in that area. So it can impact their quality of life just because the symptoms get worse when they're standing. So obviously we all stand at work, at home, and at the end of the day, they just can't make it through the rest of the day.
Sometimes also on a flight, like you get that hot patch on a leg, or I don't know what that's called. I think it's called thrombosis or something like that, or
yes.
Is that what it's called?
That's what I mentioned earlier.
Yeah.
One of the potential complications of varicose veins is you can get a phlebitis.
Okay.
So that occurs when there's a blood clot in that area of the vein.
Okay, and then you're like, oh, well, like what is that? It's almost like it feels like a sunburn or
Yes.
something like that.
It's more.
So,
it just causes pain more. I mean, more serious than that would be if you have a blood clot in your deep vein. That's a deep vein thrombosis, DVT people.
okay, so when you start, what are some of the techniques? Because I know that you do something that's a little more state of the art to help people.
Yeah, there's different options in treating vein disease. I mean, the most important thing is getting an ultrasound. It's the same thing that you do to check the baby, but you check your leg veins and see where the problem is. And based on where the problem is and what the underlying cause of that problem is, you kind of decide what treatment option you offer the patient. So if somebody that has just spider veins, it's just injection sclerotherapy. But the more advanced stages, there's different options. And most of the times, there are surgical options in the past. Now we have less invasive options. We can do the procedures in the office. There's thermal ablation and non-thermal ablation. Most people would know it as endovenous ablation, where we put a little catheter inside the vein and close it off.
Okay, so that it just caps
It shuts down, because the problem is the blood's going backwards. So in the superficial veins, there's really no issue there. You don't need those veins per se, so you can get rid of them. And
Gotcha.
that's pretty much it.
It's like an extra one. Sometimes
Yeah.
it's almost like, and I loved the imagery that that you showed me about the tree.
Correct.
Right?
Yeah.
I love that imagery because
Well-
it makes sense to me. Like you got the little twigs, so
Correct. So you have your tree trunk,
Right.
and then you have your branches. And the whole idea with that image was, it's family history, right? So varicose veins is very, one of the risk factors is hereditary. So if your parents have it, you have like 50 to 90% chance of getting varicose veins.
Also occupations. A lot of times people that spend way too much, like we talked about this, teachers, chefs, people that are always on their legs sometimes have problems that you could help them with.
Correct. I mean, obviously, like I said earlier, the symptoms occur when you stand a lot. So any occupation that requires a lot of standing is going to be having problems.
So not only are you brilliant, but you're also accessible. So can you tell me like some of the locations that people could go and get some help?
We have multiple locations throughout Long Island.
Okay.
Our main hub is in Center Ridge, but we just opened up an office in Commack, Advanced Specialty Care.
Wonderful. And Commack is pretty great because they built like this, like, I guess it's a new building that has like different things. So you could go to you to do your veins, you can go somebody else. Like, there's different
Correct.
clinical service lines there.
Yes,
right?
it's called basically complete care under one roof. So it's 500 Commack Road, and there's 30 different specialties. You can basically go in there with your entire family. You can take your mother, you can take your kid, and one-stop shop. Like,
I love it. It's really convenient.
Yes.
I thank you very, very much. Is there any tip that you think you'd like to share with the audience about how they can have the best health for their legs?
It's basically conservative measures are the first line therapy, you know, weight loss, exercise, try to keep your legs elevated if you can, if you're having symptoms. But more importantly, if you're seeking treatment is the question, right?
Right.
So who to go to?
Right. We'll go to you, but.
But, you know, as a consumer, as a patient, you want
Right.
to make sure that you go to the right physician that has the right education and training for treating varicose veins.
I
And
know
that's
one
difficult.
of the things, you know what, let's talk about that for 1 second, Dr. Tony, is that one of the things that you said is that sometimes these people are not vascular surgeons. They're just like, you know, they think it's like a car wash. You just go in, zip, 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 zap. And that's not a healthy way to go about it.
Well,
so it's better to go to someone that's an expert in that field.
Yes, you want to do some research. You want
Okay.
to go to a physician that has significant training and a board certification, as well as maybe the center that you're going to has a certain accreditation. So there are societies or nonprofit organizations. It's called IAC,
Okay.
International or Intersocietal Accreditation,
Okay.
and the purpose of that is to make sure they provide quality care. Because
Wonderful.
in the office, these procedures, anybody can just open shop and start doing it.
It's not a good idea. It's better to go to somebody that knows what they're doing.
We
Thank
try.
you very much.
Thank you very much.
Hopefully you'll come back and talk to us about, I told you, wellness is a big thing for our audience.
Sure.
And we love knowing how we can be healthy. And if we have a problem, who to go to.
I would love to.
Thank you very, very much.
Thank you, Donna.
Stay tuned for more on Live It Up. Your health matters to us. Thanks for watching.